both my mom and dad were kind of went down a road together as far as chronologically. Their first and foremost desire was to remain together. And they were married for 70 years. My perception of what transpired in their latter life and its relationship with you, Dr. Dendler, is my appreciation for what you provided in a way of not just medical information, but what was there for mom and dad was another perspective, a deep caring that they could see from you constantly, a sharing. They so looked forward to the visits. It wasn't like going to the doctor. The doctor was coming from them and respected their space, and to have that there in their own home was priceless. He had it all organized in his mind, but he looked forward to it. And your ability to put them at ease through navigating some very difficult circumstances was for us a real gift.
I think one of the most sensitive things I do is helping families with that. The patients or the residents, the senior elders can deal with it better without a lot of personal adjusting to it, as opposed to a son or a daughter or a spouse even, who, I'm not ready for this, it's too painful, I can't stand to see this happen. And my ability to help with that or to make it a transition that's as positive as possible is, if I'm able to do that, I feel like I've provided a real service.
What I appreciate about you, Dr. Dendler, is that whenever, especially with my mom right now, is as her Alzheimer's progresses, that you were there, and I can see you down the hall smiling, and I can go talk to you about my mom, about her problems, because I can't deal with all the emotions and everything that's going on with my mom and with our recent loss with my dad. So it's nice just to be able to see you and have that connection and to help, with my mom. That's big for me. It's, extremely big for me.
I'll never forget the experience of knowing when it was time to have a physician who he totally respected. He was a pharmacist, Jack Bishop, and that Dr. Dendler was my partner. So my experience was to see that race kind of begin and then work with you in partnership to know that you have choices when it comes to their care.
You were able to, as a physician, give them a perspective of some of the things that were coming, not just things that were happening then. And so that, for me, was, and I'm sure the rest of the family, was so important, because we got a better transition of things that you knew were going to happen that we hadn't experienced yet, and certainly they hadn't experienced yet.
Some people say taking care of these patients, they don't have much time left, you can't really have a relationship. A lot of them have dementia, they don't even remember who you are. But it wasn't just a relationship with that individual person, it was a relationship with a family. If you have a patient with asthma, or seizures, or diabetes, or dementia, those are all chronic illnesses. It's not just the patient that has the asthma, it's the family that has the asthma. It's the family that has the diabetes. It's the family that has the dementia.
The compassion that you gave outwardly, it was so evident that it wasn't an act, it wasn't a 15-minute visit, it wasn't a bill, super bill, it wasn't a lab test, it was them. It was all about them. You went to their heart and their soul, and that, no matter what the diagnosis is, like you said, I can't always fix it, but I can make them live with it, and live with it with dignity and with honor, and face what we're all facing. And I thank you.